So good evening, everyone. My name is Ken Trzaska, president here at Lewis and Clark Community College. I do appreciate everyone joining us this evening. Before I get into a quick opening statement to frame this evening, a couple of announcements. We are recording today's session. Those of you joining online, just as a process step, if you have a question, simply raise your sort of Zoom hand and we will give you the opportunity to ask your question. Another thing is, we did ask for questions to be submitted prior to this session, and we did receive a number of questions, and my plan this evening is to kind of walk through those questions and responses, and then, of course, open it up to anyone online or those of you in the live audience this evening. So again, I do want to thank you all for being here this evening and taking time out of your day. I know there's a lot happening in our communities and in our world today, so thank you for your interest and concern. The purpose and focus of our work here at Lewis and Clark is to tirelessly serve you and bring value and opportunity through education and community building opportunities. I shared a message recently with our full campus team about our important connection that we all have to one another, and that this is required to be at our best and to best serve and support our students, our community, and most importantly, one another. In the end, the idea shared was that every single person matters or nobody matters at all. And at the essence of this evening, that is what it's about, sharing a message that is hopefully going to bring us closer together versus bringing us farther apart. In the end, the idea that everyone matters or no one matters is what informs our belief to assure that Lewis and Clark is a safe and accessible environment for every single student and every member of our community. So today, as you know, we are gathered to address a dividing topic, COVID-19, and in particular, the recent vaccine and mask mandate from the governor. I want to be clear on one point, that Lewis and Clark respects and honors every single voice and opinion, and we will follow guidelines and protocols necessary to best facilitate and sustain a safe and healthy teaching and learning environment for all. And so this evening, the plan is to address your questions and to hopefully provide some answers that will help you feel more comfortable with what's happening on our campus. But in the end, hopefully to reassure you that we are all here to serve you, our community, and our students. And we appreciate your investment and, most importantly, your confidence in the work that so many team members, upwards of 600 team members on this campus, who are engaged each and every day to make sure that each and every one of you interested in engaging with us has the opportunity to move forward. So with that being said, I'm going to start with those questions that were submitted. It may seem like I'm reading these. I'm going to highlight some of the comments that we've all kind of come together and made around the questions. And then, of course, if you do have questions online, we'll have some time for you to raise your hand and certainly ask those live. So the first question that's come to us is, can't Lewis and Clark just ignore the mandate? Why don't you? As I said in my opening comments, Lewis and Clark is committed to hearing all voices and serving everyone, but to be sure that we are facilitating a safe and healthy environment for all. So Lewis and Clark is a public 2-year community college. We have every intention to follow the mandate and avoid risking potential state funding loss, and quite frankly, creating an environment on campus that is unsafe and unhealthy. So we will follow the mandate. Where is the proof that masks even work? So naturally, this is a dividing one. I'm referring to the CDC, May 2021, where they have cited at least 10 studies that have confirmed the benefit of universal mask wearing and community level analysis. Essentially, it's about what risk are we willing to take. If we have the ability to save one person, to help one person, then we're going to do everything in our power to do that. So I would encourage you to take a look at the CDC, May 2021, where they cite 10 studies from across the globe that do say masks do have an effect on limiting and narrowing the spread of COVID-19. Why should I get vaccinated when I still can get COVID-19 and spread it to others? On this one, no vaccine protects anyone 100% against any disease. It's a risk we all have to play. That said, these vaccines are incredibly effective in stopping infections and reducing disease severity among those who do experience breakthrough infections. No matter what we do, folks, there's a risk. This is about looking out for one another. Breakthrough infections, while starting to increase lately, are more likely to happen in groups of people who are higher in risk, such as older populations and people who are immune compromised. The source here is World Health Organization, August 2021. Symptoms and side effects of those who are infected and vaccinated are reported to be milder. The majority of those who are hospitalized or die from COVID-19 are unvaccinated. Vaccinated individuals spread the virus for a shorter time. Recent studies show that vaccinated people with breakthrough cases appear to spread the virus for a shorter time than unvaccinated people. Although similar amounts of viral genetic material have been found in those infected with Delta variant, regardless of vaccination status, the amount of viral genetic material decreases faster in those who are vaccinated. Again, this is cited by the Center for Disease Control, August of 2021. If the vaccine works, why do I need to wear a mask? Again, as I cited in the previous question response, no vaccine is 100% effective. I think that has to be a given for us. Vaccinated and unvaccinated individuals should continue to wear masks indoors and in public, ultimately to reduce the risk of being infected with the Delta variant and possibly spreading it to unvaccinated people and others, especially in areas where transmission rates are high. Vaccinated individuals who are at a higher risk of a breakthrough infection may also protect themselves by wearing a mask. Is Lewis and Clark against freedom? I think I addressed this in my opening comments. We are about hearing everyone's voice, and I said this and I'll say it again. Everybody's voice matters or no one matters, or nobody's matters. And for me, that comes from my heart. It's not about we're trying to say you have to do this or else. There are options and opportunities for us to meet you where you're at to allow you the opportunity to continue your education or continue your engagement at the college. Lewis and Clark seeks to empower team members and students, which is why we are offering multiple options to comply with the mandate. There are pathways forward. Those who cannot or do not want to receive the vaccine can choose to undergo free weekly testing on campus or can attempt to change their classes to an online virtual environment. Our enrollment team will attempt to accommodate students as they are able and truly will do our very best. We'll turn every stone over to try to do whatever we can to accommodate your needs and expectations. If we have team members on campus or anyone who has concerns, we'll direct you to our HR team. And of course, as everyone knows on our campus team, you can contact me directly at any time, and I will do my very best to address your concern. And many of you have already done that, and I appreciate your confidence in me and being able to respond directly to you. Do all students have the option to opt out of the vaccine and get tested, or do certain programs, i.e. our health programs, have their own requirements? The goal of the executive order is for all higher education personnel and students to be vaccinated. Those who cannot be vaccinated will have the option to be tested weekly, except in cases where vaccination is required by a student's dental or a clinical site such as dental, as is the case in many of our health programs. Most of those programs where students are doing clinicals, there are requirements at those partner clinical sites, and the expectation is that we're following those guidelines as well. Those students will not be able to opt out of vaccinations. What exemptions are allowed for vaccines and/or masks, and how do I get one? Those who are not vaccinated must be tested weekly, per the executive order. And again, we're providing free testing on campus through a partner organization. There are no exemptions to either being vaccinated or tested. There is just a process essentially to move forward if you choose not to be vaccinated. Students requesting an accommodation for mask must do so through the college's Center for Access and Accommodations by completing the form at our website, www.lc.edu/access. And we can post that to the forum for those of you online. The department will utilize information from this form to determine a reasonable accommodation for students. Anyone seeking a medical accommodation or exemption must work with their doctor to provide a medical history information to help the college make the most informed decision. Any accommodation approved will most likely involve allowing a student to wear a face shield or assisting the student to make a switch to online learning. Not all accommodations are approved. And again, that's not a barrier. That's where we're looking out for the full campus. But again, whatever we can do to meet you where you're at, we're going to try everything possible. Are there exemptions to testing? If so, what are they? No. The only way someone can be exempt from weekly testing per the executive order is to become vaccinated or to move into the online environment. What happens if I get COVID and am cleared to come to campus? Do I still get weekly testing? If a person tests positive for COVID-19, the local public health department, under the direction of the CDC, will guide Lewis and Clark as to whether testing should not be done for 3 months following diagnosis, as it will remain positive even when the person is no longer spreading the virus. And the understanding right now with that point is that could be up to 3 months. And so, we're looking for the medical authority to help inform how we manage that process. So those of you who may be in that sort of cohort, be patient and please stay engaged with us as we can help guide you through that. I'm vaccinated. Where can I submit this information to Lewis and Clark? So Lewis and Clark has created a form for you to submit your vaccination information to eliminate the weekly testing requirement. Campus leadership has emailed the form to team members, and students will receive the link tomorrow, Wednesday, September 1st. After Wednesday, you can find the link at, again, our website, www.lc.edu/coronavirus indefinitely. As you receive your first dose, second dose, and any potential boosters in the future, you can return to this form and resubmit. Where and when will testing take place each week so I can make it to class on time? This is currently being determined. We are going to set up clinics on campus, and so please stay tuned to our website. And again, our coronavirus dedicated space on the website will have that updated on a regular basis. How will the testing process work? This logistics is still being developed and underway. And again, appreciate your patience. One of the things that we're working up against is this September deadline. And so we're sort of working backwards and being sure we have protocols and systems and processes in place. And we're just going to really ask for your patience and understanding as we navigate through this, as does everyone else. What kind of tests will be used? In the coming weeks, Lewis and Clark will be working with Shield, the partner I had referenced earlier, but not by name, to provide free PCR saliva-based testing on campus. In the meantime, beginning September 7th, we will offer free on-campus rapid antigen tests, which are performed using an anterior nasal swab. It can be uncomfortable, but should not be painful. If you have other questions on that, you can certainly let us know. How soon will I know my results? The rapid tests will provide results in 10 to 15 minutes. Once we transition to the PCR saliva-based tests, which are sent off to lab for processing, those results are typically 12 to 24 hours before you know your result. The accuracy of those tests are much higher than, of course, the rapid test. It's at mid-60s to maybe mid to upper 90s, respectively. How will I or my instructors know I am able to be on campus? If you are sick or experiencing symptoms, if you test positive for COVID, or if you are aware that you may have been in direct contact with COVID positive individual, simply do not come to campus. Contact the Lewis and Clark Family Health Clinic, and the number for them, again, we'll post this in the chat room, 618-468-6800. That's 618-468-6800 as soon as possible for further instructions. You can also call or text 468-6818 after hours, and all this information will be accessible for you. The other piece I'll add there is you can let your instructor know, send them an email. Perhaps you have your faculty member's phone number, reach out to them in whichever way the faculty member has directed you to do so. Ultimately, getting through this is about communication and being transparent and keeping everyone informed on what's happening. If the college becomes aware that you have been exposed to a COVID positive person or a person who is suspected of being positive, you will receive a communication, usually or typically via a LC alert for further instructions. So again, if you're in a class, for example, someone in your class reports they're positive, you were in that class, you will be informed through our process. At this point, you are responsible for communicating your status to your instructors. Campus contact tracers will also communicate with your faculty to indicate when you are not medically cleared to come to campus. And once you have been medically cleared to return to campus, that will also be communicated to your faculty member. Can I switch my classes to virtual if I don't want to get vaccinated or tested? The Enrollment Center is accommodating these requests as they are able. Please understand that not all classes are taught in a virtual environment. In addition, at this point in the semester, we will take the approval of the faculty member teaching the course to allow students to add late. So please contact your academic advisor for further direction. Can I get a refund for classes? A withdrawal date for a full refund is Friday, September 3rd. So if you feel we can't meet you where you're at or support you, which we desperately ask that you give us the opportunity to do so, you do have until Friday, September 3rd to withdraw from Lewis and Clark. And if you're withdrawing temporarily, we hope to see you back. If you're withdrawing permanently, we certainly really do hate to see you go. What happens if I get vaccinated and I have a bad reaction? Will the college be liable for making me get the vaccine? Bad reactions to the COVID-19 vaccinations are very, very rare. If you are prone to serious reactions, you should talk to your medical provider about whether the vaccine is right for you. The college is not mandating you to get the vaccine. You have the option to test weekly. Can vaccinated people also get tested, since they can pass on the virus as well? Vaccinated people are not required to get tested per the mandate. If a vaccinated person is experiencing symptoms, however, they should not come to campus, and they should contact the Family Health Clinic at that number I gave again, 468-6800, for further instructions. If a vaccinated person does want to be tested for their own, just comfort, certainly welcome to do that. Are the tests safe? Yes, they are safe. There is a misleading video that we learned about through the Associated Press in March 2021 online that's claiming that nose swabs, that these tests used to detect COVID-19 contain an ingredient, ethylene oxide, that causes cancer. According to the U.S. Centers for Disease Control and Prevention, ethylene oxide is often used to sterilize medical equipment that are moisture and heat sensitive. While it is listed to federal agencies as a carcinogen with long-term exposure, experts say the gas is used only in small amounts to sterilize COVID-19 testing kits and would not present a cancer hazard. Again, Associated Press. Are the tests even accurate? According to the Center for Disease Control and Prevention, laboratory-based tests such as the PCR have a generally high test sensitivity. They are considered the most accurate available and usually take a day or so to process. We cited this early, about 12 to 24 hours. Rapid antigen tests are less accurate, but results are typically available in as little as 15 minutes. According to the CDC, antigen test sensitivity varied depending on the time in the course of one's infection, but is considered to have moderate to high sensitivity during peak viral load. Compared to molecular tests, antigen tests are more likely to generate false negative results, especially when performed on people who don't have symptoms. This is Yale Medicine, August 21. All COVID tests are more accurate after 3 to 5 days of symptoms, as they are better able to detect the increased viral load. Next question, who is making a profit on all of this? The tests and vaccinations are being offered for free. If I work at the college and I refuse to get vaccinated, will my insurance be affected? Our current medical provider, Blue Cross Blue Shield of Illinois, has not indicated any changes of insurance benefits based on vaccination status at this time. So at this time, no. How will the testing work for my child who is on campus once weekly for music instructions, swim classes, etc.? The executive order does indicate both credit and non-credit students. Any student taking classes on campus must be compliant. The college will accept test results from your child's school weekly for clearance to be on campus. This process is being finalized and will be communicated in the very near future. What age does a child have to be before they have to wear a mask, get tested weekly? Masks are required for individuals ages 2+, so all K through 12 and higher education students and personnel are included in the vaccine testing mandate. And the final question that we received prior to this session is, how long will this mandate last? The mandate's going into effect September 5th and into the unforeseeable future. And of course, when we have the information, we share that out immediately to the rest of you in the community and amongst our student body and of course our team. So I can revisit any of these questions again if you'd like, but I thought as a process, I would at least go through those questions that were provided prior to the session, and now certainly would open up the opportunity for anyone joining us online or any of you here in the live audience if you have questions for me. I will preface this by doing my very best to answer your questions. If I cannot answer your question, I promise to get you an answer within the next 24 hours or less. So please, if you have a question online, you can raise your hand and we'll do our best to answer.
Yeah, can we just ask anyone who's joining us via Zoom, if you would please raise your Zoom hand and we'll call upon you to be able to ask your question. We do have a screen here, as you can see. We just want to be able to see you whenever you speak. So thank you. Okay, we have a question or a raised hand from Matt Nagel. So Matt, if you'd like to ask your question.
How's it going? Yeah, I got a question. If we are doing the weekly testing and we get a positive result for COVID, will we be given the option to take it again in case it's a false positive?
I don't believe so. I think you have one opportunity to take it, and then isn't there a waiting time that you have to wait about 5 days? So with the PCR test, if that comes back positive, you want to be able to take that again? Or
Well, yeah, because I used to work at Beverly Farms, and the cases that I saw with false positives were overwhelming. So I'm wondering because if you get a positive result, then that's it. 2 weeks, you're off the campus. You're missing a lot of class time. So I was wondering if you had policies in place where you could test again, or would it be up to you to go to another clinic and take a test and then come back and say, hey, like I got a negative result?
I mean, I'm comfortable saying, I mean, if you feel confident that, hey, listen, this is not right, then I think, you know, that's up to you to go forward and say, let me get another test. And then if that comes back with an opposite result, you can let us know that, and then we can move forward from there.
Okay, thank you.
And
Yeah.
Matt, I'll just add, this is Lori Artis, Vice President of Administration, and I'm sorry you can't see me. I would just add to that, that the saliva-based PCR test that we are going to bring to campus, hopefully here in the next month or so, they are 99% accurate, and of course, much less or much easier to administer. So in terms of the antigen test that we'll be offering in the interim, I think, you know, we'll follow the CDC guidance, and those will be administered by clinicians from our healthcare clinic, and they can offer you advice as well at that time, if that were to happen.
Okay, thank you.
You're welcome. Any other questions online? And after the session this evening, if you do have questions, this isn't like the only opportunity to ask questions. You can certainly email us, or certainly, you know, just contact any of us on the leadership team or myself directly, and I'd be happy to answer the question directly or get the answer for you, as I've said. So, anyone else? Got 30 minutes, so don't be shy.
We do have a hand up, JC, go ahead.
Hi, sorry, I'm having problems with my video. Give me just 1 second.
No problem.
Okay, I think I've got it now. So you stated, so anybody that comes on to campus will need a test that includes adults and children alike. Was that what you stated? I think I heard you said something about swimming lessons or something like that.
Yeah, so any student who is enrolled in a course, non-credit or credit, that
Okay,
is ages 2 and above, so K through 12, including adults, would have to have testing if they aren't vaccinated, or and of course, if it's you know, a younger adult and they're going to high school or middle school or, you know, second grade or whatever it is, we will also accept the school's testing. You can show that as documentation. But yes, they would be required to be tested or show proof of vaccination.
okay, thank you.
You're welcome, JC. Thank you. Any other questions? I think we had a link, Lori, didn't we, for Google Docs, or how did we do that to collect the questions before? We may want to post that.
We collected those mainly from our social media accounts,
Okay.
But definitely we could put all of those responses up
Yeah.
on the coronavirus webpage.
Yeah, so please don't hesitate if you have questions afterwards or something pops into your mind later. So.
JC, did you have another question, or is your hand just still raised? I'm sorry, I thought I saw you.
No, I raised it again, sorry.
Okay, go ahead.
I noticed that we're recording the session. Is the link going to be sent out via email following the session?
We can also post that on the coronavirus webpage as well, and,
Yep.
and it can live there as kind of a visual FAQ, if you will.
Awesome, thank you.
Anyone in the audience? We have some folks in the audience today, so anyone here? We have a question from the audience. Yeah, just go ahead and use the mic.
I know you're still working out the details as far as the weekly testing, but is this something that, is there going to be like a database like everybody's testing is going into, or is it just like on the student to report if they have a positive test, or what do you think this might look like?
We're developing a database right now, and we are like all 40 7 other colleges, community colleges in the state doing the same thing. So we're looking at a way to track that and to be able to maintain it. So that's in the works now. And our plan, we're working against that deadline to have all this in place, but we will be having that in place. And I don't know if Lori, you want to add any comments, because I know Lori and Brett Reinhardt, who isn't here this evening, but he's.
Yeah, we recognize that not everyone will be tested necessarily on our campus. Some people are tested because they have to for their work responsibilities or other things they're involved in. So we will offer an opportunity for those who aren't tested on campus to also bring those test results to our testing site. We will be manually inputting everything into our database so we can begin tracking and then notifying anyone who, hasn't tested for the week or we don't have a vaccination status on. So for compliance purposes, yes, we will have to track all of that.
Yep. Thank you for the question.
Brett, was there anything you wanted to add to that? I see you brought your
Well,
camera.
He isn't, okay. I thought I
No,
saw-
I think that covers it. We're still working out the details of how that comes through, but most definitely that's exactly how we intend to go about doing it.
Yep. Anyone else? Nothing? Okay, well, just in the spirit of everyone's time and to respect everyone's time, again, if you have questions that pop into your mind or things that are worrying you or you have concerns about, please never hesitate to reach out to us. As I stated in my opening comments, we are really doing our very best to accommodate everyone. And we very much respect everyone's opinion and perspective, and give us that opportunity to serve you and to do whatever we can to be sure you get to the goal that you've set out as a student. And then as community members, really invite your voices to campus. And, I think if we work together and understand that there's tremendous strength in our connection to one another, we're going to get through this COVID-19 thing. It's good. We'll look back, who knows, hopefully sooner than later, and hopefully recognize that resilience, confidence, and connection and collaboration and respect were, I think, the virtues that got us through. So I want to thank all of you for joining this evening. Thank you, those of you in the live audience, and of course, those of you online. And again, if you have questions, concerns, or anything whatsoever, please don't hesitate to reach out to anybody on the campus leadership team or to me directly. And I will give out my direct email, which is out there anyway, but an easy one is just Dr. T, so drt@lc.edu. Email me at any time, reach out, and I promise to get back to you very quickly. So thank you all so much. Have a wonderful evening. Take care of yourselves and look forward to seeing you soon. Thank you.